Empathy is defined as the act of correctly acknowledging the emotional state of another without experiencing the state oneself. A quote that I like to put with empathy is that empathy is seeing with the eyes of another, listening with the ears of another, and feeling with the heart of another. And that's by Alfred Adler. Another quote that I think resounds with empathy is, resolve to be tender with the young, compassionate with the aged, sympathetic with the striving, and tolerant with the weak and wrong, because sometime in your life you will have been all of these, and that's by Buddha. Lastly, the other quote I would like to talk about for empathy is that learning to stand in someone else's shoes, to see through their eyes, that's how peace begins, and it's up to you to make that happen. Empathy is a quality of character that can change the world. For students, it's really important that we understand that for each of us, we have a unique experience of what makes us empathetic. Our capacity to be empathetic to others is unique to us, and it's effective and satisfying for us to be able to give the best possible care that we can. What makes me most empathetic is that, personally, I have a cousin who is a drug addict, and a lot of people struggle with finding the compassion to understand what they're going through. They think that they want to be that way, and they think that they have no other choice, and they tend to not be understanding or compassionate to them. Because I have someone that's so close to my family and someone that I'm so close to his parents, I find the empathy in that because I've seen what it does to a family, and I see how he's not who he is normally, and it's because of the drugs that's the way he is. So with that, I'm able to have a greater empathy and understanding for the people that are drug addicts because I know one personally, and I know that they don't make that decision because they want to. They make that decision because they're mentally ill, and it's a sickness to be a drug addict. And that's what makes me unique in my experiences of empathy, is my real world connections are what make me a better nurse based off what I have experienced myself, and that's different for each and every nurse. I think that the best way for all of us to promote empathy as nurses and student nurses is to utilize each of our unique empathy experiences and share them with one another to help others become more empathetic to their situations. A few things that I think are important to do is, one, to put aside your viewpoint. Try to see the point of view from the other person's point of view. Two, validate the other person's perspective. Three, examine your attitude. Four, listen, which I think is extremely important. You learn more from another person if you listen rather than try and talk. And five, ask what the other person would do. A lot of the time we make assumptions, and that doesn't help us be any more empathetic. Empathy is very unique to each of us, and if we can control and utilize our empathy, we will be better nurses.
In the healthcare setting, if there's a lack of empathy, patients might feel dissatisfaction with their care. Also, they might feel frustrations toward their providers or nurses. If there is empathy, they might feel that they might feel relief that they actually are being supported, that they're being cared for properly, that the nurses actually show compassion towards them.
It means that as a nurse, you're giving the best care that you can give to your patients while being compassionate and understanding of every unique situation that occurs in the healthcare system. One incident that I had while in my clinical experiences was I had a nurse who was overseeing my admission with a new patient that was coming down from post-op. She expected me to do most of her work for her, including the care plan that I have never done in the past. And once the patient was received from post-op, she spent the first 15 minutes during the admission while on her phone and completely ignoring the patient who had many questions and was a little agitated from the surgery, a little worried, and I spent most of that time next to the bedside answering the questions. I noticed that the nurse missed a bunch of things during the admissions assessment, and after she had excused herself to leave off of her shift, I continued to stay in the patient's room and just kind of answer her questions, make her comfortable, feeling that she was really important as a patient in this room. I believe that as a nurse, you should be compassionate towards your patients, and it is very helpful to answer as many questions as you can to decrease their worry. And if we're not taking into account the patient's emotions, then are we really showing empathy?
Empathy to me means being able to actually understand someone even though you don't really recognize what they're going through. Example for me would be I'm a nursing aide back home where I live, and what happened was a patient had gotten back from surgery, a knee surgery, and I was helping her move out of her chair where she was in, and she was really crying a lot and just exaggerating how much pain she was. I'm like, okay, well, just take your time, and I may not understand what pain you're going through, but I do understand you're going through some pain, so if you need to cry, then just cry it out, and just let me know when you're ready to move. And I think being able to actually understand someone and trying to say, like, what they might be going through and just appreciating the acknowledgement of what they're going through is what really is an impactful statement with empathy to give best patient care.
Home health aide, and I take care of an 87-year-old lady named Gloria. Gloria to me is my world, and I really enjoy taking care of her. However, previously, when I was being trained about a year ago, I was being trained by a young, I believe she was 17 at that point, and she demonstrated some characteristics that I would have said were unempathetic, and that's when I really started to care about what the patient is perceiving from my end. So what happened was that one day Gloria and I were talking about her previous day, because I worked every other day with the other aide, and Gloria had said that she had a bad day, and I asked her, I said, what? And she said, well, I asked the other aide if I could have some Boost. And the aide had said no. And that took me off guard a little bit. And so then I asked Gloria, what did you say to her after she had said no, that you couldn't have any Boost? And Gloria said, please get me some Boost. And the aide got up and went outside to get on her cell phone. And that day on, I really tried to take the extra mile to ensure that not only Gloria, but anyone else in my life gets the kind of care and compassion that they deserve. And that to me is what empathy means.
Hi everyone, so the question that we were asked to answer was, how do we promote empathy in nursing? And I think it starts off when we recognize how much time we spend judging others and how that does not allow us to provide quality care. So a quote that I found online was, empathy is seeing with the eyes of another, listening with the ears of another, and feeling with the heart of another. And this quote to me is so meaningful to how we can optimize empathy in nursing, because it shows how we value people's feelings and how that might affect a situation, a vulnerable situation where the impact that it might have on an individual would be different. So when trying to empathize with others, it is important to recognize what they need regardless of how they got to this point. And as a future nurse, I find it to be my mission to show patients that I'm here for them and that I care about what they need. And thus far in the nursing field, I feel like the one thing that I've learned the most is that in order to serve others most effectively, I myself have to be just as vulnerable as they are in order to understand exactly how they feel. It may not be to the same capacity that it would to them, but at the same time, it shows them that I'm trying to understand their feelings and how this situation right now is affecting them.